If you've recently sustained an injury, weekend warriors, you'll want to stay tuned because direct access to the rehabilitation services here at Bluff Medical Center is now available. And I'm joined by a great panel of folks today. Physical therapist Rachel Oldenburg, Dawn Hallwood, Latisse Scott, occupational therapist, and physical therapist Karen Patton. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center in Mauston, and we're discussing their comprehensive rehabilitation services that they have here right on site. And I'm joined now by physical therapist Rachel Oldenburg. How are you, Rachel?
Good. How are you, Justin?
Excellent. Good to have you back in the program.
Good to be here.
So we're talking about the rehabilitation services offered here, and since the last time we've talked on this program, direct access is now available to patients. So explain what that means for patients.
Direct access will allow a patient to come see a physical therapist without an order from their primary care provider. So in the past, if a patient sustained an injury, they would have to schedule an appointment to see their primary care provider, who would then refer them to physical therapy. They'd have to schedule an appointment with the physical therapist, and then by the time those patients are getting to us, time has lapsed, and that's time that we could have been using working on therapy, getting that person back to their highest level of function.
Right.
Unfortunately, direct access is only available for certain types of insurances, and Medicare and Medicaid are not currently covered.
Okay. Maybe someday, though.
Hopefully.
We can hope for that someday. And that's really interesting that you bring up the idea of time because, you know, when we think about any other acute injury, you know, time is always a factor when trying to, you know, treat the injury. And so when it's something that might not be as, I guess, is, what's the word I'm looking for? Deadly, for lack of a better term, something that maybe is a little bit less so. Time is just equally as important, though.
Absolutely, yes.
Yeah. So have you seen an increase in the number of patients using physical therapy services since you started with direct access?
Yes, direct access has been in place now for about a month here, and we're seeing an increase in the patients that are utilizing this service, which is very exciting because we're getting patients in sooner to start their episode of care, and it's a shorter episode of care. So we're getting people back on their feet, moving faster, quicker, which we're really excited about.
Yeah, absolutely. It's always getting people back to their highest level of functioning, as you mentioned before, as soon as possible. What types of injuries are you treating here, and what can patients expect when they first come for physical therapy?
This is really meant for people that have musculoskeletal related problems. So someone was out playing softball over the weekend, twisted their ankle, sprained their knee, tweaked their shoulder. Those people that don't have a major condition going on, something just doesn't feel quite right, they can get in to see us. It's not meant for people that have had a stroke or have lymphedema. Those patients do need to follow up with their primary care provider, and then they'll get the correct referral sent over.
That might be a different level of treatment or a different, just different in general.
Different path, yes.
Yeah, different path, exactly. So musculoskeletal, we talked about that last year, the weekend warrior folks are the people that we're kind of talking about. What are some of the benefits of using physical therapy services in a hospital setting, like here in Bluff, versus in the private sector?
So we have a very close connection with the doctors. You know, most of them are right here on site. So if a patient comes in through direct access and we think something's not quite right, if they need to be seen by a specialty doctor, we can hook that all up. So being in the same facility, we have great communication between us and the doctors, and it can make that transition so much easier and a lot faster than someone coming from an outside hospital.
Absolutely, lots of good things there. And it's what's interesting to me is, again, coming back to the idea that time is so important here, and that, you know, when somebody sustains an injury like that, even if it's not a life-threatening injury, that was the word I was looking for, life-threatening injury, time is still important. And so when people have to kind of go through all that rigmarole of setting up time with their primary care physician, not that it's a bad idea to see your primary care provider, but it just takes time away that can be treated more effectively.
And the primary care providers, this then opens up their schedule for those patients that really do need to be seen by their primary care.
It's a win-win for everybody, it sounds
is.
like.
Saves time, saves money, gets people back on their feet faster, so we're really excited about it.
Absolutely. Well, Rachel Oldenburg, thank you so much for joining us today. We really appreciate all the information. When we come back, we're going to talk a little bit about pelvic floor therapy, but we're going to see you towards the end of the program.
Yes.
So don't go too far, okay? And don't you go away. There's more Wisconsin Doctors coming up after the break. We're back here at Bluff Medical Center, and we've been discussing the rehabilitation services that are offered here on site in the hospital, which I think is really, really cool. And now we're talking with Dawn Hallwood, who is a physical therapist here. How are you, Dawn?
Good, thank you.
Thank you for being here. First time on Wisconsin Doctors.
Yeah,
it's always good to
pleasure.
have a newcomer. So now we're going to talk a little bit about pelvic floor therapy today. First, I want to make sure that our viewers know that not only are you a physical therapist, but you are also the outpatient coordinator.
Yes.
So you'd be kind of the point of contact for people who are ending their therapy, so to speak. So let's talk a little bit about pelvic floor therapy. How does it work? What is it?
Well, pelvic floor therapy treats a wide range of conditions. I treat pelvic pain, as well as urinary incontinence and incontinence of the bowels. So on a patient's first visit, I do a really thorough examination. It includes a very detailed history about everything in their life, their physical activity, what they drink, what they eat, how their symptoms affect everything they do on a daily basis. And then I'd go into the physical examination part, and I put all those pieces together to figure out how can I help this person regain that quality of life that they're missing. Because most of these people, when they come in, they're missing out on quality of life from the symptoms that they're having.
Absolutely, that's very limiting symptoms. Who would be good candidates for pelvic floor therapy? Who are you typically seeing?
So I see a wide range of people, many different ages and different conditions. I see people that experience pelvic pain and urinary incontinence and bowel incontinence. Urinary incontinence is something that affects many people. 13 million Americans suffer from symptoms of urinary incontinence.
Wow, 13 million.
But most of those people are afraid to talk about it because of the way it impacts them, and it's an embarrassing topic.
Right.
Bowel incontinence is also one of those topics that people just don't talk about.
I think people have this perception that this shouldn't be happening to me, and so there must be something wrong with me.
Right. And it's more common than people think, and there is help out there, and help that doesn't come in the form of a pill or an immediate surgery to correct those symptoms. There are a few different kinds of incontinence of the bladder. One is stress incontinence, and that is when someone coughs, sneezes, laughs, or picks up something heavy, and they might feel a trickle of urine come out. There's also what's called urge incontinence, and that's when you have a strong feeling of urgency, like, oh, I gotta go right now, and then you feel a little leak. And sometimes that can happen just out of habit, like someone goes grocery shopping, gets home, and as soon as they put the key in the door, they're like, oh, I'm not gonna make it.
Some sort of trigger kind of makes them think, okay, it's time to go now.
Right.
Yeah.
Then there's a form of mixed incontinence, which combines both of those symptoms. So maybe they have a little bit of the stress symptoms and a little bit of the urge symptoms. There's also something called functional incontinence, and that's when people maybe have some physical limitation in their strength or their range of motion or their ability to get to the bathroom, and they lose urine or whatever on the way to the bathroom. So I treat all those areas of incontinence.
Okay, very good. Yeah. So there may be a common perception, especially when it comes to urinary incontinence, that this might be something that is just for women only, but you treat men as well for this.
Absolutely. So I've treated men for pelvic pain and for urinary incontinence, and the treatment is just as effective on men as it is women.
Good to know. And what kind of results are you seeing? What can people expect if they go in for pelvic floor treatment? What can people expect once the treatment is complete?
Well, I get life-changing results out of some of the treatments we do. So you have someone who comes in and they feel like they can't leave their house because they have to go to the bathroom every half hour, or they're afraid of wetting themselves when they go out. And by the time we're done, with everyone that I've seen, I've seen some degree of improvement, and some of the improvement has been phenomenal.
Wow.
Where they feel like they have control of their life again.
Life-changing.
Life-changing.
It's amazing how something that so many people take for granted, not being able to have complete control of that really can be life-changing in a bad way, and then similarly getting it treated to where it's back to in your control again, that can be life-changing in a good way.
Yes.
And you guys do a great job here at Mile Bluff. So.
Thank you.
Dawn Hallwood, thank you so much for joining us today. We appreciate and thanks. Good job on your first time today here on Wisconsin Doctors. We'll have to have you back.
We'll see.
We'll see. When we come back, we're going to talk a little bit more about the comprehensive rehabilitation services here at Mile Bluff Medical Center. Don't go away. There's more Wisconsin Doctors after the break. Back here at Mile Bluff Medical Center talking about the comprehensive rehabilitation services they have to offer here, and we're talking now with occupational therapist Latisse Scott. How are you, Latisse?
I'm doing good. How are you?
Good, good. Another newcomer on Wisconsin Doctors. Good to have you with us today.
Thank you.
So you specialize in working with people who have lymphedema. First of all, can you describe what lymphedema is for our viewers?
Yeah. Lymphedema is a disruption to the lymphatic system. Usually traditional lymphedema is increased swelling and also proteins in their system as well. And there are actually several different types of lymphedema too. There's primary and secondary.
Okay.
So it's kind of a wide variety, really.
Okay. Primary and secondary, and what are are you able to explain the difference between the two of those?
Primary is something usually they're born with. It's more of a genetic defect. You can even see it in children. I usually treat people with secondary lymphedema.
Okay.
Someone who's had damage to their system, such as like a breast cancer patient, where they have lymph nodes removed, and then they would get swelling in their arm. Or something like that.
Gotcha. So it's swelling, and you typically treat people with secondary lymphedema who have had cancer or something like that in the past.
Yep. Or just, there could be many reasons why there's a disrupt to the lymphatic system, but I would say that's probably the most common thing that most people come in for.
So how is lymphedema typically treated?
Usually you treat it with, we do a manual massage. It's manual edema mobilization. And then follow it up with compression bandaging, some exercise, and then usually you give them a home exercise program.
Sure, okay. Based on their needs and things like that. So.
Yep.
Now you work very closely with the doctors and even the pharmacist here at Mile Bluff Medical Center. What are you typically discussing with them in regards to your patients?
Usually with the doctors, I keep them well informed as to how the patient is doing. If I have any concerns, say I thought a patient might have developed a cellulitis infection, I would call the doctor immediately and try to get them seen right away so we can get them on some antibiotics or something like that. And working with the pharmacist, usually it's to get them medical grade compression stockings or any specific kind of bandaging tool that they might need.
Any of the tools that they might need to treat the person with lymphedema. So let's talk real briefly. We got a couple minutes left. I want to make sure that our viewers know the difference between physical therapy and occupational therapy. So I'm throwing you a little bit of a curveball here, but can you describe the difference between physical therapy and occupational therapy?
Occupational therapy, what I tell most people is I work with them on anything that they would do to occupy their time.
Okay,
so
that's a good way to describe it.
Yeah, so if they come to me and they tell me, I can't pull up my pants because maybe even because of the swelling, in relation to lymphedema, or because they fractured their hand and they can't make a fist, So I would kind of focus my tasks on getting them to be able to do those functional tasks again, depending on what their needs would be. Physical therapy, a lot of times they kind of focus on the whole body.
Getting things moving too.
Yeah, that's a good way of putting it.
But occupational therapists is kind of, your job is to try to get them to where they can do the activities of daily life again that they weren't able to do before.
Yep.
And so what are some of the typical things that, when bringing it back to lymphedema now, what are some of the typical things that you see people, you mentioned not being able to make a fist or not being able to bend down and maybe pull their pants up or something like that. What are some of the other things that you're typically seeing and helping patients to be able to recover in terms of their activities of daily living?
A lot of times people, especially if they have leg edema, they're unable to walk.
Right.
And like I said, they can't even put their pants on, sometimes shoes, so then if they can't get their shoes on, how are they supposed to leave their house?
Right.
So they end up walking around their stocking feet, and especially since we live in Wisconsin, that's kind of a problem in the wintertime.
Right.
For those who have swelling in their hands, like I said, they can't make a fist, so how are they supposed to grasp items?
Right.
Even as something as simple as taking a drink of water
Right.
can become very challenging.
Right.
And just
Wow.
very upsetting.
Yeah, it's so interesting. Like everything we've talked about today, so much of that stuff people take for granted. Being able to pick something up or bend over, but when you can't do that, that's so limiting,
Yeah.
and to the point of distress. And you really change lives here by helping
Yeah.
people to regain all of that. So that's awesome. And you work closely with the physicians and the primary care providers and knowing exactly what the needs of the patients are because you're all in the same building and on the same team.
Exactly.
Very good. Latice Scott, thank you so much for joining us today, and good job on your first run here in Wisconsin Doctors.
Thank you.
We'll have you back again.
Hopefully.
All right. Well, cool. We're going to continue talking a little bit more about the comprehensive services here, rehabilitation services offered at Bluff Medical Center when we come back. Don't go away. Back with Wisconsin Doctors here at Bluff Medical Center. We've been talking about their comprehensive rehabilitation services, and I'm joined now by, again, Rachel Oldenburg and Karen Patton. Welcome back.
Thank you.
We were
Good
just
to be here.
Yeah, we were just discussing. We can't remember if this is your fourth or your fifth time, so we're going to have to get you a five-timers mug at some point. So you're going to be talking a little bit about physical therapy for Parkinson's patients, Karen. So, and there's a program that goes with that called the BIG program. Tell us
Yes.
about BIG.
LSVT BIG is a program that it's an intensive amplitude-based treatment approach.
Okay.
It's a standardized program for people with Parkinson's disease. Typically, there are 4 classic symptoms of Parkinson's: slowed movements, smaller movements or less movements. There's a rigidity factor to the muscle fibers themselves.
Right.
And when you have that, you tend to become posturally unstable.
Right.
So people with Parkinson's have a masked face, they have limited movement, they reach for a glass of water and sometimes they don't get it.
Yeah.
Their walking pattern gets slow, shuffling. So they start tripping, they start falling, they start tipping, and they don't have that movement to catch
Right.
themselves. And what's interesting with Parkinson's is that people don't realize they're taking small, slow steps.
Right.
So BIG is a treatment program. It's pretty intense. It's 4 times a week for 4
Okay.
weeks.
Wow.
And we start with big posture.
Okay.
We have big reaching
Okay.
activities. We have big steps, forward and backward, big step to the side, come back to the middle.
That must be what you mean by amplitude based, is
Amplitude.
how big it is.
Big.
Yes. Wow.
Big.
Big.
Big. Everything
Bigger
is
than,
big.
I'm guessing bigger than they probably normally would, like somebody without Parkinson's even would, just so that they can kind of increase that range of motion.
A little bit.
A little bit.
To someone with Parkinson's, this seems like a huge reach.
Right.
To you and I, that I got to reach
That's-
that far to get what I'm reaching for.
Right.
Um,
Right.
And the idea, so in addition to these exercises, then there's these functional tasks like opening the refrigerator door,
Right.
taking big steps with a nice big arm swing to
Yeah.
open the garage door,
Yeah.
walk down the steps,
Right.
go out and get into your car. You carry over big to all of your activities that you do throughout the day.
Right.
And what you're trying to do is recalibrate that system
Right.
so that big becomes their normal again.
So that's really kind of why this is so important, is because it can probably lessen the effects of Parkinson's, which of course is a
Yes.
progressive disease, but it can lessen the effects of that so that they can maintain that higher functionality for a longer period of
Exactly.
time.
Parkinson's disease is progressive, and my job is to help them have a baseline program so they can stay big in all of their activities
Yeah.
and stay big for a longer period of time.
That's just such a good reminder to say stay big,
Big.
to the
They hear
patients.
big a lot.
So Rachel, Mile Bluff's, I'm going to kind of bring this all around full circle here. Mile Bluff's physical therapy department, or I should say rehabilitation services, ranks very well compared to other facilities across the country. Tell us a little bit about this.
So we use a measuring tool called FOTO, which stands for Focusing on Therapeutic Outcomes.
FOTO, okay.
Yes, and it's used nationwide at different facilities, and it rates patients based on a survey. So they take their survey on the first day, and then they take that survey again multiple times throughout their episode of care.
Okay.
And it helps track their progress, and then we can compare those to other people's statistics across the country.
Okay.
So there's a couple things that we're pretty proud of, in that over 99% of our patients are satisfied with their services and would tell a friend about it.
Okay.
So for us, that's pretty exciting.
99, wow.
Over 99.
Wow.
Yes. And then patients are ranked on a point scale.
Uh-huh.
The national average of points of improvement is 16.5.
Okay.
Here at Mile Bluff, we're at 18.2.
Wow,
So we're
okay.
significantly higher than what the national average is.
Wow.
And then the other thing that we're really excited about is how efficient we are.
Yes.
So it only takes us just under 9.5 treatments to get a patient better,
Okay.
when the national average is almost 12.5.
Wow, okay.
So we're getting patients better faster, they're having better results, and they're satisfied with them.
And they're more satisfied
And they're more
too.
satisfied. So it's all bringing it full circle back to direct access. Faster
Yes.
we can get patients in, the better the outcomes are going to be.
Yes, so patients can, if they have a musculoskeletal injury of some kind, they can come right in and they can set up an appointment with you guys.
And give us a call.
Yep.
So we can let you know if your insurance is covered,
Yes.
when we can get you in,
Very
how quickly
important.
we can get you in. So if you call the hospital, they'll get you transferred to the rehab department and we'll get you hooked up.
We have just literally a couple seconds left, but where can any viewers who may have some questions go if they have questions?
Just give us a call here at the hospital.
Very good. All right. Well, Rachel Oldenburg and Karen Patton, thank you so much for being
Thanks.
here with us. And I want to thank my other guests as well, and all of our viewers from all of us here at Mile Bluff Medical Center and Wisconsin's 57. Live longer, live better. We'll see you next time.